Welcome back to Main Street Living. To many of us, the following public health concern is going to be a surprise, maybe even a shock, since it rarely grabs the headlines. But in California in recent years, there has been a substantial increase in sexually transmitted infections.
That's right. And Santa Barbara County is trying to change that and are making sure members of their community can get testing done easily. Let's take a look.
Did you know sexually transmitted infections, STIs, affect people of all ages, backgrounds, and from all walks of life? The best way to know if you have an STI is to get tested. Order yourself a self-test kit at takemehome.org for free.
Santa Barbara County Public Health is committed to providing a comprehensive and confidential sexual health services to the residents of Santa Barbara County. And joining us now to discuss this very important topic is Dr. Lynn Fitzgibbons and Dr. Chelsea Dean. Dr. Fitzgibbons is an infectious disease specialist for Santa Barbara County and Cottage Hospital. And Dr. Dean is a primary care physician and HIV specialist. Doctors, thank you for joining us today.
Of course.
Thank you for having us.
So, Dr. Dean, let's start first off. We want to hear about the Santa Barbara County Public Health STI and HIV Prevention campaign and why it's so important.
So at the Santa Barbara County Healthcare Center, we really believe that all teenagers, young adults, everyone deserves accurate information and support when it comes to their own sexual health. As was mentioned, STIs are on the rise, and I think we don't realize that it affects all ages, backgrounds, people from all walks of life. In the US alone, there are 20 million new cases a year, and half of those are occurring in young people who are ages 15 to 24 years. It's really important to note that most STIs are not necessarily visible and have no signs or symptoms. But if they're left untreated, they can lead to further health problems. So we are really aggressively advocating for routine testing, and we're excited to promote home testing through a website called takemehome.org.
Yeah,
Dr. Dean, I'm sorry. What are some of the educational programs that you focus on?
So prevention. Just like I mentioned, most STIs are not visible, and the best way to figure out if you have an STI is to go to a doctor and get tested. And I think that process really starts with starting the conversation with your partner or partners and really encouraging them to get tested as well. Like we mentioned, we're seeing a lot of infections like chlamydia, gonorrhea, and early syphilis, and these STIs are treatable and preventable, but the first step is getting tested.
Yes, and I was just going to say the education part obviously is so important. Some people just don't know what to look for. And like you said, we can't see a lot of these things. Another thing that has probably come into prominence in the last couple of years we've heard more about, Dr. Fitzgibbons, we see this term PrEP or PrEP. What is it and how effective is it at preventing HIV?
Thanks. So PrEP is incredibly effective at preventing HIV. PrEP stands for pre-exposure prophylaxis, or I like to think of it as pre-exposure prevention. It's a pill that you take every day if you think you may be at risk of catching HIV. Examples would be perhaps someone who is HIV negative, does not have HIV, but is in a relationship, a sexual intimate relationship with someone who does have HIV. They could take this medicine every day, and it's essentially 100% effective in preventing catching HIV for that person. Other examples, maybe someone who's having sexual contact, having sex or intimate contact with someone or multiple people who they don't know whether or not they have HIV. And the final group of people that really benefit from PrEP or taking this pill every day to prevent HIV are those people who struggle with drug use and perhaps injection drug use, and again, run the risk of acquiring, catching HIV. And this medicine, again, is highly, highly protective.
Dr. Fitzgibbons, this discussion with your partner or partners, it's often taboo, and at the least, it's just uncomfortable. But why is sexual health discussion so important?
You know, it's a great question. It comes up all the time. I think it's important to just say out loud, our current generation is better at this, better at talking about this than any generation before them, from my perspective. I think that young people, people who are sexually active, are more comfortable. Perhaps it's because of social media, perhaps it's because of the internet, perhaps it's because times are changing and progress moves forward. but I think that it's becoming less taboo than it has been in the past. And I just wanted to, I think congratulate people for that forward movement. With that, though, we have to make sure that while we're comfortable talking about sex more commonly than certainly when I was young, we also have to include preventing STIs in that conversation. That part cannot be taboo. We need to remember that while, we as humans want to feel healthy and strong, that certainly involves feeling sexually healthy, emotionally healthy, physically healthy. And unfortunately, many of these STIs can cause us distress and symptoms for a short period of time, but some of them can actually cause long-term complications. HIV is not a curable disease in 2023. If someone acquires HIV, we have good medicines to treat it, but we don't have a cure. Similarly, some of the sexually transmitted infections, which are seemingly easier to treat, chlamydia and gonorrhea, they can actually get in the way of a woman's ability to have a baby down the road, fertility problems. And so, again, I just encourage people, as we are getting better at talking about sex, let's also make sure that we're getting better about talking about how to keep ourselves sexually healthy and safe, protected from STIs.
Absolutely. We appreciate both of you coming on to talk to us about this today. Real quick, how do people get tested? How easy is it?
So I'll start by just saying getting tested is easy and it's important. Again, we have access through a variety of programs, through the public health department, through local physicians, through Planned Parenthood and other wonderful organizations to make sure that we get tested frequently, and that, again, we walk with confidence knowing that we don't have one of these infections. And if we do, get the treatment that we need as fast as possible to keep ourselves healthy and make sure that our partners are also healthy. Dr. Dean?
Yeah, I wanted to plug a new resource from the county called takemehome.org. So it's an online website where it's really easy to get home STI testing delivered to you, and it's completely confidential. I know it's hard sometimes to get to a clinic, to go to see the doctor, and this is just the easiest way to get tested because it's literally delivered to your house. So very excited about that, takemehome.org.
Thank you very much, doctors. Thank you for joining us today. And because of you being here today, the residents of Santa Barbara County have become a little bit more informed.
Yes, and all of us. Don't go anywhere, though. We will have more Main Street Living after this. Stay with us.